We innovate healthcare.
Navina had just stopped breastfeeding her twin daughters when she discovered a lump in her breast. With so much to live for, she was obviously shattered by her diagnosis, but determined to beat it.
Unfortunately, to many people, you mention the word cancer and the first thing they think of is death. And I've proven to them that it doesn't always result in death. Some of my best of friends couldn't speak with me, and I would receive SMSs or emails or messages saying, "I'm so sorry, I can't be there for you. It's just I don't know what to say to you."
Further tests revealed that Navina had stage 3 breast cancer and required a mastectomy. Oncologist Dr Mol guided her through her treatment.
1 in 9 women will develop breast cancer, and we see younger and younger women with breast cancer every day. So it's an epidemic, and it's an epidemic that there are many causes for. So you're dealing with an organ that's essentially fat, and there's a whole lot of lymph nodes. So what happens is women present with a lump. And if you catch that early, it's only the lump that's involved. If it then continues to grow and you don't pick it up, then what happens is the lump from there, bits break off. And then these little lymph nodes become affected. So that means now it's getting more aggressive and it spreads a bit more. And when the regional nodes are involved, this is still curable. But when the cancer spreads past the breast to involve another organ, like say the lungs or the liver, that's a point at which it's usually no longer curable. Still treatable. We can still keep those patients well for many years, but it's no longer curable.
Sisters Melanie and Lindsay have both braved the disease, and as part of the Think Beyond Pink initiative, they encourage women to educate themselves about breast cancer.
I was diagnosed with a very specific, aggressive type of cancer known as HER2, and that they did tell me I needed to have a more aggressive form of treatment. It actually came out to be about 8 months all in all. I was advised immediately that I needed to have a right breast mastectomy and that I didn't have much time to make that decision. It was either 3 days or a week away, and so it was a very quick decision. And I went with it because in that way I felt that the cancer would have been removed, and then it would be a lot easier for me to cope with the treatment.
HER2 breast cancer is a particular aggressive type of breast cancer. When it's there and overexpressed, which means in abundance, that breast cancer is then a turbocharged variety. So it makes that breast cancer stronger, faster growing, more aggressive.
Everybody is so busy in life. It's not expected that you drop everything in your life and be around this person all the time. Whatever you do, don't cry, because that does not help much at all. But be there for them by understanding what they're going through and ask them what they need.
Navina is a patient of mine, and we treated her because she had HER2. We treated her with chemotherapy, but also with a biological agent. And we gave it to her intravenously for a whole year. And what this did is it reduced the risk of her breast cancer significantly. So we converted somebody like Navina, who would have initially had the worst prognosis of breast cancer. In other words, she would have been, under normal circumstances, dead in under 2 years, to somebody that today, with the advent of that treatment given to her for a year, I would make that the best prognosis breast cancer that a woman has today.
I think every woman who has had breast cancer, or anyone who's been, threatened with a disease, say that you need to live every minute and, do the things you want to do. Don't put it off till then, because you don't know if you're going to have a then. It was a dreadful thing, but it was very positive, and in a way, I'm thankful that I had it, because it brought me back down to earth.
I think the most important thing is that we take some responsibility for our breast health. We can't just ignore this threat and then expect the doctors to cure us and fix us and battle against things because we left it too long. So for me, the most important thing for women to do and to know is that breast cancer is manageable. Some of the doctors even say that it's curable if you catch it early. So your self-checks, your mammograms, your ultrasounds, your just general awareness of what's happening on the breast cancer front is really vitally important.
Donning pink and orange ribbons this October, these survivors proved that self-awareness could save your life.
Wearing a pink ribbon is nice, but pretty pointless if you're not going to do anything about it. So teach your daughters and your granddaughters from the age of puberty the importance of breast self-examinations. And don't just think about having that mammogram. Pick up the phone and make an appointment now, because if it's detected and treated early, breast cancer can be beaten.
We innovate healthcare.